As we explained before the break, in order to get a health care bill passed, Democrats in Congress are going to have to go it alone. His party may be in the minority, but House Republican Leader John Boehner is heading a solid wall of opposition. I spoke with him Friday at the Capitol. First of all, thank you so much for joining us. I appreciate it.
Glad to be with you.
I heard something the other day from the president, and knowing I was going to come here and interview you, we pulled it because I wanted to get your reaction to it. Over here.
I know a lot of people view this as a partisan issue, but both parties have found areas where we agree. What we've ended up with is a proposal that's somewhere in the middle, one that incorporates the best from Democrats and Republicans, best ideas.
Somewhere in the middle. He may have taken a couple of Republican ideas and then put them into his 2,733-page bill, but this bill is nowhere close to the middle.
They did take the idea of undercover agents to check into Medicare fraud. There's no public option, which Republicans and many Democrats hated. There are pilot programs for medical malpractice reform. There is insurance industry reform, which you all are for, having to do with caps on lifetime benefits and that kind of thing. And there's tax credits for small businesses. Why isn't that enough?
We could come to an agreement on probably 8 or 10 common sense steps that you outlined to make our health care system better. But we can't come to an agreement on 8 or 10 things and throw them into a 2,700-page bill and ask my colleagues to vote for $500 billion worth of Medicare cuts. They aren't going back into saving Medicare. They're going to come out of Medicare in order to pay for this new entitlement program. $500 billion in higher taxes at a time when we're asking Americans to reinvest in the economy. But no, the government wants to create this new entitlement program.
But also, looking at the scoring from CBO of the House and the Senate, it shows it brings the deficit down. That if you take this comprehensive look, which a lot of people argue on the Democratic side, you have to have a comprehensive look because everything's kind of connected to everything else. So if you're looking at two bills, and they'll come out somewhere with parts of all of them, that are going to bring down the deficit, isn't that something you support?
Well, I'm highly skeptical of the so-called CBO numbers that bring down the deficit. And I say that because
aren't they the gold standard?
There's a number of steps in this bill where they're double counting the savings. I just think that's inappropriate. Listen, the American people want us to do something about the cost of health insurance. This bill will raise the cost of health insurance. Even according to CBO and all the outside estimates, is that if you already have health insurance, you're going to pay more under their proposal.
I don't want to get too far into the weeds, but we do know that there have also been studies showing that with government subsidies, people will be able to buy more insurance, and that in that sense, it may go up. But insurance policy versus the same insurance policy, it'll go down. So that's another study, and I don't want to...
But Candy, you talked about their bill supposedly bringing down the deficit. Let's remember there are worth of tax increases and Medicare cuts and only 6 years of additional benefits.
You don't think there's enough waste, fraud, and abuse in Medicare to pay for that? When you're looking at the cuts in Medicare, you don't think there's that much waste, fraud, and abuse?
If there's money to be saved in Medicare, and I believe there is, it ought to be returned to the Medicare program to extend the life of the program, not be used to start a new entitlement program.
They look as though they certainly have the numbers to pass this, the Democrats.
Really?
What is your...
Listen, they've got 40 more Democrats in the House than they have Republicans. They've got, 59, or they've got 19 more Democrats in the Senate, or 18 than they have Republicans. And they can pass this all on their own. The only bipartisanship that's involved in this town right now with regard to health care is there's bipartisan opposition to what they're attempting to do.
Do you think, because you're a pretty good vote counter, does she have 216, the Speaker?
If she had 216 votes, this bill would be long gone. And remember, they tried to do this in June and July last year. If they had the votes then, it'd be law. They tried to pass it in September, October, November, December, January, February. Guess what? They don't have the votes. The American people don't want to take this step toward government-run health insurance. It's a dangerous step. because we do have the best health care system in the world.
I want to point out that the Democrats clearly have argued and will argue that it's not a government-run program, that if you like your insurance, you can keep your insurance.
Well, that's not true, though. It's one of those things that keeps being said, but it's not true, and here's why. First, with the employer mandate, some employers are going to look at this, at the penalty, and say, I spend a lot more than that providing health care to my employees, and so I'm going to drop it.
But they'll have a menu of choices.
Forcing you then to go to change.
Sure.
And so you can't keep it.
But they will have a menu of choices the way this is set out. 3 or 4 in this exchange where people can look at and pick something from that. Would you agree with that?
The government-run exchange, the expectation is you'll have 3 or 4 plans as designed by the federal government.
What's the Republican role now on the House side? What is there left for you all to do?
I'm doing everything I can to prevent this bill from becoming law, plain and simple. We've offered our ideas. We've asked the president to sit down and work with us. They've refused all the way through the process. And
you had the summit.
No, they had the summit. We offered our ideas.
And he incorporated some, didn't he?
And took a couple of Republican breadcrumbs and put them on top of their 2,700-page bill. That's not good enough. And so what I'm doing is working with my colleagues to keep the American people engaged in this fight. I don't have enough votes on my side of the aisle to stop the bill. But I, along with the majority of the American people who are opposed to this, can stop this bill. And we're going to do everything we can to make it difficult for them, if not impossible, to pass a bill.
When we come back, House Republican Leader Boehner on how he sees politics playing out in this year's midterm and the scandal that forced out Congressman Eric Massa.
So you did grope someone, right?
So, Larry, when you grab someone and you're wrestling, I don't know how to describe that word.
Welcome back to State of the Union, continuing now with part 2 of my interview with House Republican Leader John Boehner. I want to shift over to the politics of this and politics in general because it's that kind of year. And
It is that kind of a year.
Yes, it is. And I want to play you something from a former colleague.
I'd like to see more organization, more coordination, more communications on the outside in support of what the Republicans are doing. We have no organization, nothing near what the Democrats have built over the last 10 years. They have one of the most powerful political coalitions I've ever seen.
Now, he's talking about Republican organization and Republican chances, and he said, look, if they just sit around and do nothing, Republicans will gain seats. But he clearly thinks that Republicans are not organized enough, don't have enough of a framework to take advantage of an anti-incumbent year at any rate. Do you disagree with that?
Yeah, to some extent. There's no question that the Democrats have a huge outside organization that pumps hundreds of millions of dollars into the political process outside of the campaign finance rules. But I can tell you this. We've got more candidates than we've ever had. We've got better candidates than we ever had. We have a better process of helping to grow candidates and grow campaigns than we've ever had. No question that we're going to get outspent in this election. But I think that we have a chance at winning Republican control of the House.
Really?
And I'm going to do everything I can to see that it happens.
Outside chance? Big chance?
Listen, it's a steep climb, but it's doable.
Let me ask you about Tea Party candidates and their role in the Republican Party, since they don't necessarily see themselves as Republicans. If you have a Tea Party candidate that challenges a moderate in a swing district, a moderate Republican, a couple things might happen. The moderate Republican might be so damaged that it's hard for him to win him or her to win in the swing district, or the Tea Party candidate has had to swing so far to the conservative side that they're not that appealing in a moderate district. Are you worried about those Tea Party candidates?
No. I think competition's a good thing. You know, I've got 11 brothers and sisters. I learned about competition early on. But it makes everybody better. And so we've had Tea Party candidates in primaries. More competition, the better.
New York 23, you lost the seat.
Well, that was a very unusual situation because the candidate wasn't in a primary. It was picked by a handful of party bosses in a back room somewhere. It didn't work real well. But when it comes to the Tea Party folks, I think our job is to listen to them. And I'm going to listen to them. I'm going to walk with them and do everything I can to have them, interest them in working with us to bring about a smaller, less costly, and more accountable government here in Washington.
So do you basically welcome challenges from the Tea Party to some of your sitting Republicans?
Listen, when I talked about the number of candidates we have, I'll give you an example. We've got 94 of the top 100 competitive districts with one or more candidates in the race. And in most cases, it's more than one. There's a lot of interest around the country. People want to take a more active role, and I think we ought to welcome that type of involvement and activity.
Let me ask you two sort of other issue questions. The Massa investigation. You won an overwhelming bipartisan support to tell the Ethics Committee to look at what the leadership knew about the alleged inappropriate behavior by former Congressman Massa. What is the end? What do you want out of this?
We've seen the trust break down between the American people and their Congress. And it's been clear to me for some time that we have to work here in this institution to rebuild those bonds of trust. And when things like this happen, those who are responsible ought to be held accountable. And in the case of the member himself, he's resigned. But it's also pretty clear that there are a lot of people, including some of the leaders on the Democrat side, who were in fact informed of this.
And
so
if they were, what happens, do you think?
Did they take the appropriate action?
And if they didn't?
If they didn't, then they should suffer the consequences.
Which is?
I don't know what the answers are. All I'm asking for is the Ethics Committee to get to the bottom of what did people know, when did they know it, and what did they do about it.
Do you want to go down this road? Because Republicans are not, in fact, 2006 was one of the reasons given for what was essentially just a swamping of Republican candidates was ethical problems. Is this something you want to do now? Because it's going to bring up all of the Republican misbehavior.
Now, listen, when I took over as leader a little over 2 years ago, I told my colleagues that I was going to hold them to a higher standard. The American people have every right to expect the highest ethical standards from their elected officials. And it's in that pursuit that I think this investigation is warranted. I don't know what the outcome is going to be, but I think that the American people deserve the answers, and I think the Congress deserves the answers.
Well, one last question, and this is on terrorism and Khalid Sheikh Mohammed and civilian trials versus military tribunals. It appears that there may be a deal in the works which the president would reverse the Holder decision, Attorney General Holder's decision to try these 9/11 suspects in a civilian court to perhaps a military tribunal in exchange for money to bring some of these prisoners they can't try and put them in a supermax wherever they reside. Is that acceptable to you?
We'll have to see what the final pieces of this look like, but we have a world-class facility at Guantanamo.
But they're going to close that. You know that.
Well,
I mean,
no, they're not. They keep saying they are, but they want $500 million from this Congress to rehabilitate this prison in Northwest Illinois. I want to see who the members are who are going to vote for this. I wouldn't vote for this if you put a gun to my head.
but it's Guantanamo Bay has such a bad feel to it across the world, and that's one of the reasons given for fine. It's a great facility, but it's one of the reasons that people in the world looked at America and thought they have really strayed from their value system. So if you were to move, which has been a very important Republican point on foreign policy, if you were to move these trials into a military tribunal, why not say, fine, bring them. Guantanamo Bay has a bad feel to it. Let's put them in a supermax and be done with it.
Well, I think we have a world-class facility at Guantanamo. I think it's the appropriate place to hold these prisoners, and they can do the tribunals right there at Guantanamo. There is no reason to bring these terrorists into the United States, no reason to increase the threat level here because they're here and their friends may want to come. It makes no sense to me, and I don't think the Congress will appropriate one dime to move those prisoners from Guantanamo to the United States.
I appreciate your time.
Nice to see you.
Thank you so much.